with Dr. Benita Zahn.
And good evening, and welcome to the special edition of Health Beat. We're talking all things COVID-19 vaccine. Now, granted, the rollout has been anything but smooth. I did reach out to the state health department, but was told they didn't have anybody available to join in this discussion. So we won't be dealing with the difficulties in getting a vaccine appointment. Rather, we're going to be addressing questions you have about the vaccine. You can post your questions on our Facebook page. I'm going to be monitoring so I can get all your questions in. Have a great panel of experts for you. Dr. Eric Yeager, a microbiologist and assistant professor at the Albany College of Pharmacy and Health Sciences. Give us a little wave there, Doc. There we go. Also with us, Dr. Cindy Serro-Conlon. She's an anesthesiologist at Glens Falls Hospital. Good to have you with us. Dr. Joe Bertino is a clinical pharmacologist and editor of the Journal of Clinical Pharmacology. And Keith Brown is the interim public health director for Schenectady County Public Health Services. Good to have you as well. Angela just messaged and she said that she took the first shot and she still got COVID because clearly you're not fully protected. Does she still take the second shot? It is scheduled.
Yes, you do.
You do?
And I'd be curious to know what the time course was. I have a colleague who got a COVID vaccine, and 2 days later, he developed COVID. Well, he didn't develop COVID due to the vaccine. It turned out he was exposed a week earlier.
Mask after getting the vaccine, both. There are folks that are wondering, why do you still have to wear a mask if you get both shots?
That's a good question. There are a number of reasons. Number one, immunity is not immediate after the vaccine. Clearly, we think that you need more than one shot. That's what the data show at this point. Secondly, getting the vaccine does not protect against contracting COVID. It protects against serious illness in 95% of patients who who do contract it. And the other question that remains unanswered is that we don't know if I've been vaccinated and I've been exposed, I may not be ill, but we don't know yet whether I can still transmit that to other people.
Lori also asked, and some other folks did, there's concern, again, it goes back to something we talked about a few minutes ago. If we're trying to get, the government is trying to get as many people to get the first shot as possible, what's to say shot number 2 will be available when you're due to get it? And Keith, you may want to jump in here. I see you nodding.
Yeah, so thus far, the state is actually holding on. So the federal government and the state are holding on to the same number of doses that get shipped out for second doses. So the way it works for us is that as we administer our first doses, those are calculated and retained by the state, so that when it's time for us to do the second doses, we'll get. For example, we've been doing about 600 administrations a week here at Schenectady County Public Health Services. And so the 600 that we do in that given week, during the week that's 28 days later, we'll get an additional 600 on top of the new 600 that we'll be administering.
The other question that ran through a number of these is, there's been the concern, so I suppose this is the myth-busting part of it. Boy, we got this done very quickly, and how safe would this vaccine be because you did it so, not you, the companies did it so fast. Let's talk a little bit about that. We got about 2 more minutes here.
Yeah, I think the clinical trials that were done, I think it was fast, but it was not rushed. I think they were done in a very rigorous fashion, like all clinical trials are. And I think the couple things were, there was some fortuitousness that we had the mRNA very quickly after the virus was identified. Additionally, with the Operation Warp Speed, there's a lot of finances and resources put in behind so companies could start to manufacture before the results were known. And then second, often with clinical trials, it takes time to enlist volunteers. And there was such an urgency and demand and interest in this vaccine that they were able to meet their population for the studies rather quickly. And unfortunately, there was COVID in the community, so they could have groups that were infected by COVID and determine the efficacy.
I want to thank all of our guests tonight, Dr. Serro-Conlon, Dr. Eric Yeager, Dr. Bertino, Keith Brown. We do have the State Health Department's website on our webpage. It's under links, so you can go there, look at that, see if you can get in and get your shot scheduled. And we want to thank all of you for joining us. Mask, hand washing, social distancing, stay well.